may think that math is not involved in the medical field. Oh, I'm not good at math, so I'll just be a doctor. This is the wrong approach because that statement is false. Math is everywhere in the medical field, and without it, patients would not get the correct treatment they needed. So, if you're looking to go into the field of medicine, hit the math books, or it will be a tough road for you and your future patients. Doctors, nurses, and medical researchers all use math on a daily basis. How? Prescriptions and medication. Almost every day, doctors write prescriptions to their patients for different occasions. Whether if it is for a small cold or something bigger like cancer, these prescriptions need to have a specific dosage amount that is fit for the patient. Doctors use equations to find out how much of the medication the patient will need based on their weight, height, and other factors. Also, doctors sometimes need to convert the medication size into different units. For example, kilograms to milligrams. Even the smallest amount of difference in a dosage size can be extremely harmful to the patient, so doctors need to be attentive in this process. Lastly, doctors need to predict how long the medication will stay in the body, with probability and percentages. For example, if a patient takes a 200 milligram pill and the decrease of the medication per hour is 10%, then in the first hour it will be 200 milligrams, the next hour is 20 milligrams, to 2 milligrams, then finally 1/5 milligrams, and so on. All calculations done by doctors need to be correct, but done speedily. Prescriptions and medications are a small portion of the math doctors use, but they need to be precise in these calculations. In an interview with Michael DeBrule, he describes how he uses math to calculate the correct dosage sizes for his patients.
When we're calculating dose titrations for finding how much a drug gives a lethal dose of, killing 50% of cells, or any other dose or amount of cells we want dead, obviously you need to calculate that, so that's very important. Not to mention all statistical work that needs to be done in order to gain significance with results and show that result is true, not just happening by random chance.
CAT scans. CAT scans are an advanced type of X-ray where the machine rotates 360 degrees, capturing pictures at all different angles, creating an inside 3D look of whatever body part. With CAT scans, it allows doctors to get a 3D view of the brain or other body organs. However, when the CAT scan is printed, doctors have to look at the 3D image geometrically. Interpreting the image can be difficult, so doctors need to use geometry to interpret the scan correctly. Body mass index. In the medical world, a person's body mass index is a common and useful measure. It calculates if you are overweight based on your height and weight in pounds. Your BMI is your weight in pounds multiplied by 704.7 all over your height in inches squared. For example, in this problem, the person's weight is 145 pounds multiplied by 704.7 all over the person's height, which is 66, and you square that, and you get 23.46 about. Finding cures for diseases. In an interview with Michael Gelman, a researcher from Stanford, He describes his experiences using math in the medical field and in his own research.
I use math, simple and advanced, both in my clinical work and in my research, which is most of what I do at Stanford. For research, I acquire raw data, and I transform that raw data into an interpretable, understandable form. So I have a bunch of numbers that tell me how particular cells behave at different concentrations of the drug. And fundamentally, it's underlying math that lets me convert that first into a graph, lets me normalize, do statistics, lets me fit a curve to that, and lets me come up with a final value of how effective that drug is in that particular situation.
Medical researchers use mostly math in their quest for finding cures for specific diseases. First, they gather the raw data from experiments and tests. Then, they use this data and put it into graphs, charts, and equations. Using statistics, the researcher calculates to see if the drug is successful, and hopefully it is. Overall, mathematics plays a crucial role in the medical field because people's lives are actually involved. One mathematical error and someone's life could be at stake. So, the calculations done have to be precise and be done in a speedily manner. So, if you have interest in the medical field, make sure you don't leave out the math part in your studies. Thanks for watching.
Pile up 180.
Can you hear me? Tell me your name.
Richard.
We're gonna take care of you, Richard.
I've got to run away. I've got to get away from the pain. You drive into the heart of me.
Once I ran to you,
Now I run from you.
this tainted love you've given, I give you all that boy could give you. Take my tears and that's not it.
He's crashing!
Turtles! Will you?